So I got an interesting question from Cheryl, who was asking about the use of FMT with digital distortions in a pediatric case. And when I was thinking about how we deal with those cases, the same principle also applies to adult feet with hammer toes or claw toes. Now I've got a volunteer here who doesn't really have the true digital deformity of a hammer toe. However, I'll show you the way we deal with it, and then you can certainly apply that treatment method to cases of hammer toes, claw toes, and pediatric digital deformities. So if we take the second toe, imagine that's the one that's peaked up with the proximal IP joint sitting high. What we do is we utilise the typical mobilisation routine, and we'll also have some focus with the FMT mobilisation at the MTP joint of extend, rotate, up, down, side to side, so that we can release the connective tissues in that area. Then what needs to happen is, to help the tissues adapt to a more effective position, is a simple splinting mechanism to hold the toe. And this is really important because then it gives the best chance for the connective tissue restrictions to adapt to the new position and be able to improve their digital position. So the way we do that, typically we'll just use some sports tape. If this was a pediatric case, I'd use micropore. So it's a very gentle tape and gentle on the skin. So tear off a piece of tape, and what we're going to do is splint this toe down into the correct position. And it's a little bit counterintuitive because the toe that we're going to splint is actually the toe that doesn't have anything stuck on it. So we're going to plantar position the second toe. And the way we do that is we begin with the anchoring piece on the big toe, then wrap the tape over the dorsum of the toe that you're working on, and then, getting some assistance here, then you're going to simply position the tape. So position the toe into a corrected, improved position, and then anchor the tape against the adjacent toe, and then simply just wrap the tape around and lock it over, and the two adhesive sides will hold themselves in place, and that will keep the toe in position. Tape will last 2 or 3 days, and it will then actually get some dynamic adaptation and limit the toe's ability to go back into its contracted position. So you'll see the second toe is not actually attached, but the splinting of the two adjacent toes means you can get that improved position, hold it for a longer period of time, and get greater benefit from your FMT work. Another adjunct treatment to use with this is utilising some direct fascial release, and typically using an instrument-assisted soft tissue release technique. That can work really well to stretch out the fascial restrictions along the tendon sheath and the dorsal contractures of the actual MTP joint. But that kept in place in conjunction with the FMT will end up with the toes being held and adapting to a better working position. And I hope that's beneficial for you. And this being the festive season, we'll wish you all very well, and make sure that if you find some mistletoe, that you make the most of the opportunity. Cheers.